I'm going to hand this over to Dr. Ferraro to finish it up.
Thanks, Larry. One thing Larry didn't mention that I'll just highlight, one of the advantages of using, collecting umbilical cord tissue and blood from the foal is that you can use those cells in the mare. And so you may have a valuable mare, you know, and this fellow from Overbrook told me, he said, you know, that yearling I just had out of that mare, he may be worth $1 million, or he might not be worth a quarter, but I know that mare's worth $5 million. I'm more interested in her than I am in him. And he said, and the next foal, or the last foal, might be better than this one. So we did a little study at the university, and we found that, as in people also, if you collect stem cells from umbilical tissue, you can use them in that foal, in his mother, and in his half siblings. So that's one advantage of collecting at birth. Unfortunately, it looks like the male is probably out, so we're as usual, we're left out to dry all us males. But the female lines are covered anyway. Now, the thing I want to mention to you is that what we're talking about today and what you've heard about, we're using stem cells, and they're being used for a lot of things in small animals now too, and in people. But the field is changing so rapidly that what we're doing now in 3 to 5 years is going to seem pretty crude. I mean, we're going to be way advanced. We can heal tendons now. We can heal a lot of things with stem cells, but we're still basically healing with the scar. We're learning to manipulate the stem cells. We're learning what other things need to go in with the stem cells in terms of growth factors and matrix and things like that to make the cells do what we want. And so you're going to see down the road some really major changes and some big advances made that'll change it a lot. What you're doing now when you're collecting stem cells from those foals or from your yearlings is you're planning on the future in a sense. You're banking for the future because the therapies are going to be much better. But the caution I give you is that, you know, we have high expectations, and people get high expectations because you're reading about this, you're hearing about it from us, we're telling you how wonderful it's going to be. But while cellular therapy offers a promise of cure, like all new things, you know, the discovery takes a little while for the implementation to really come to fruition. And because stem cells are the hot new thing, you're going to open up the next Horse magazine, if you haven't already, and see an ad for this stem cell product and that stem cell product and that biological product. Some of them are good and some of them are bad. And if you're buying products that are inappropriately prepared or inappropriately handled and you get bad results, you're going to be disappointed, and then you're going to say, well, you know, that stem cell stuff's a lot of baloney. I can tell you it's not, but you need to be a little cautious. You need to know who you're dealing with. You need to ask some questions. That's kind of one of the reasons that Larry and I have been going around talking to people, to give you enough information to know what questions to ask, who to contact if you need some backup, because it's really important. As my old friend Charlie Whittingham used to say, this is not a business for boys in short pants. You need to know what you're doing. And so I would just caution you a little bit. Now, there are some other factors that go along with stem cells which are equally important, and Dr. Kuhlmann's going to talk about those. So we're going to switch computers here, and then he's going to talk to you a little bit about things like PRP and IRAP and some of those products, which you'll probably see us using in combination with stem cells and things like that. Are you ready to go?
Yeah.
You are.
Well, I appreciate you all coming out. As a practicing veterinarian at the racetrack, the majority of my caseload involves orthopedic injuries and orthopedic problems. We have some respiratory problems, but for the most part, what I see on a daily basis, I'm dealing with injuries that are due to, you know, fast training, and these are equine athletes. They're just like human athletes. There's always going to be an injury, and so what we're trying to do is use some of these new therapies to hopefully slow down some of the some of the processes that we see and try and heal up some of these injuries. The two subjects that I want to speak on today are PRP, which is platelet-enriched plasma, and also IRAP, which is an intra-articular therapy. At the racetrack, I'm dealing with tendon and ligament injuries and also some orthopedic injuries, some fractures. Fractures a lot of those are easy to repair, you know, surgically. Tendon, ligament injuries are a little bit more difficult. And at the racetrack also, you know, we're dealing with fairly young horse population, but some of the horses as they age, just through the repetitive training, you know, you're going to start seeing some arthritic changes going on in joints, and you get what they call osteoarthritis or DJD or degenerative joint disease. And what we want to try and do with some of these modalities is to try and slow down that process and also to speed up the healing process, particularly in the ligament and tendon injuries. The first subject I want to talk about is platelet-rich plasma. And platelets are a normal component of whole blood. We all have them in our blood. Blood consists of white cells, red cells, platelets, and they all stem from what they call progenitor cells from the bone marrow. And those cells eventually are told which cell lines to go to, and platelets are formed from the megakaryocyte. The main thing that we've always been concerned about in the past with platelet function is basically controlling hemostasis, controlling bleeding, forming clots for when you have a cut or something. And basically you have components in the blood, fibrin and stuff that will come in there and mix with platelets, and you'll get a plug when you have a cut in a vessel. And that's sort of how we've thought about platelets in the past. The formation of a clot is activated by certain factors. As you can see there, collagen, thrombin. And collagen is a very common component to the lining of vessel walls, to ligaments, tendons. And so when there's an injury to that, especially in a vessel wall, then the platelets will go to that area and they will adhere to it, and you'll start to get a plug.